www.healthcmi.com, Acupuncture Continuing Education Online. Today, acupuncture reduces heart disease risk. Researchers conclude that acupuncture reduces the risk of coronary heart disease in patients diagnosed with fibromyalgia. A massive sample size of over 158,420 patients with fibromyalgia were included in the study. A total of 81,843 patients received acupuncture, and 76,582 patients never received acupuncture. A total of 12,522 patients from all of those patients later developed coronary heart disease and were examined in a follow-up period. Of that 12,500 plus patients who developed coronary heart disease, 4,389 patients had some acupuncture treatments, and I believe they averaged about 7.5 treatments over time that they received. However, from the patients who did not get any acupuncture, 8,133 patients got coronary heart disease. It's double. In other words, acupuncture cut the risk of coronary heart disease in half, according to these statistics. The researchers conclude that acupuncture, quote, significantly decreased the risk of coronary heart disease in patients with fibromyalgia with or without comorbidities. And it gets into details, and I understand the risks of statistics because perhaps patients who are more likely to seek acupuncture are also more likely to lead a healthy lifestyle. So I don't put as much merit into these types of studies as some. Nonetheless, the statistics are out there, and it really says something about healthy lifestyle as well. It goes into more detail in this article. It's published at healthcmi.com. Simply click on news, and it will take you to the article entitled Acupuncture Reduces Heart Disease Risk, published June 10, 2017. But what's more interesting is that there are other studies here that actually show that acupuncture prevents damage to the heart. So, literally physical damage. In fact, acupuncture can even help heal certain types of heart tissue, which is not widely known. So, take a look at the article. It'll actually show you studies, including laboratory investigations, showing that acupuncture increases cardiac function and can also regulate different proteins in the system that protect the heart and prevent structural damage to the heart long term. For the heart, it's more important to prevent damage than for us to really focus on healing physical tissue damage, since that's very difficult to do. So this article is very interesting, and it really comes on the heels of another article that we had recently, and we have a podcast on how acupuncture is very successful in the treatment of cardiac arrhythmias, including atrial fibrillation. That's something that is more routine in an acupuncturist office because, again, that SANA node conduction issue where these signals are getting, let's say, messed up, that the normal sinus rhythm of the heart is incorrect because there is poor conduction, there's excess stimulation of tissue sending signals to the heart, creating unusual rhythms of the heart. That is more the forte of acupuncture than a lot of things because acupuncture specifically works on the hypothalamic pituitary axis. Acupuncture specifically works on the limbic system. In other words, acupuncture has direct measurable effects on the brain, including the default mode network, allowing that to come about in a good way. In other words, the default mode network is when the brain is not task-oriented but at rest. And acupuncture can help people restore and return to that. So if you like yoga, think of the child's pose and think of how you relax and just ground out. Think of when your mind is clear. Think of when you are rested. There's not that excess excitatory response, that excess sympathetic division of the autonomic nervous system. There isn't that excess stimulation through the sympathetic nervous system. In other words, acupuncture restores what we call parasympathetic tone to the body. So therefore, and we have a lot of research showing how acupuncture does that and why, and the chemical changes on how acupuncture regulates parasympathetic tone. But to wrap that up, acupuncture helps allow the body, allow the mind to stay in a relaxed state and to get out of a fight or flight response. And that excess signal sent to the heart from the brain is something exactly that acupuncture can regulate, which is why in our prior podcast about the article entitled Acupuncture Reverts Heart Arrhythmias to Normal, we note that University of Minnesota researchers find acupuncture effective for the treatment of cardiac arrhythmias. In a meta-analysis of 8 independent investigations, acupuncture had an 87 to 100% success rate for converting patients to a normal sinus rhythm after acupuncture. So, and there's a lot of research in that direction. So acupuncture can help patients with atrial fibrillation by literally taking them out of AFib. So instead of having electrocardioversion, you have the procedure known as acupuncture cardioversion. Instead of needing to have potentially ablation therapy on the heart, we may be able to avoid that. Now, crucial to this is that patients are not undergoing extreme stress. So let's say they have a very stressful profession, that they do things to get proper rest and not be exposed to chronic trauma. Crucial to this is diet modification. Of course, patients need to significantly reduce or eliminate alcohol consumption. This is traditional Chinese medicine theory. But just as importantly, to eliminate all caffeinated products and stimulants from the diet. So that aspect cannot be underestimated. We need a little help as acupuncturists. It's one thing for an MD or an acupuncturist to restore normal sinus rhythm to the heart and get rid of atrial fibrillation, but it can come back. And according to traditional Chinese medicine theory, that excess stimulation of the sympathetic nervous system, that destruction of parasympathetic tone through stresses, whether they be emotional or whether they be dietary, like caffeinated beverages, are causes. Now, again, caffeinated beverages are not dangerous to many people, but if one has atrial fibrillation, it's out. Just like you would say alcohol is completely out for someone with hepatitis, for example. They're just things. It's not rather a drug or a food is good or bad, but rather is it healthy and appropriate. So for AFib patients, stress reduction, no caffeinated beverage, reduce or eliminate alcohol, really move to a healthy lifestyle, get some walking or some exercise, light, nothing stressful. That's important. But the acupuncture itself, once they're in AFib, can get them out of it at a very, very high success rate. For acupuncturists, Neiguan, Shenmen, and Donzheng have been shown effective. So PC6, Heart 7, CV17, other heart points like Shinshu, Bladder 15. There's a variety of other relaxing points like Sishen Sung, Yin Tang, of course, liver 3. And if we really want to talk about liver qi stagnation from Chinese medicine history and principles, then we're really talking about excess stimulation of the sympathetic nervous system and lack of parasympathetic tone. That really is the heart of what Chinese medicine principles indicated over 2,000 years ago as liver qi stagnation, that lack of circulation through the body of normal impulses. And here we can measure that response in biomedical terms as well. The important takeaway here is that acupuncture is very helpful whether someone's taking medications or not. For example, if someone takes medications and they're not working to restore normal sinus rhythm, adding acupuncture might get them in sinus rhythm and the medications may be helpful to keep them there. Or the doctor may say, you're normal and there is no need for the medication, and then the adverse effects associated with the medication are no longer an issue. So there's many combinations of treatment therapies. The important thing is that it's safe and get someone to a safe place in their health. So it's not enough just to get an acupuncture treatment and say, well, I feel better, I'm in a normal sinus rhythm because the symptoms are gone, but one must also have an EKG to back it up and regular appointments to monitor it. It's certainly something that's not taken lightly. But again, if you go to healthcmi.com, you'll find many studies showing specifically that the EKG studies demonstrate that acupuncture can do this. So it's a great tool and something for people to consider for their friends, loved ones, acquaintances to really consider a good acupuncture treatment. We also have courses online for acupuncturists. And in fact, in our insomnia course, Acupuncture for Insomnia is the title of the course, we know the great Professor Wei Shui's treatment for insomnia and heart disease is in there, including points like PC6 and Heart7, and also PC7 combined with a few other points that is very good not only for the treatment of insomnia, but also for cardiac health. So that's a very interesting course that way because it really gives a prescription that really gets to the heart of things. I can't say enough about these findings about acupuncture and cardiac health because it saves lives and it also makes life better. Because, for example, if someone's in AFib, they might get dizzy, they might have trouble climbing stairs, they don't feel well. There's a plethora of symptoms that they're besieged with. Also, keep in mind that being able to reduce or eliminate certain medications also prevents adverse effects associated with those medications. And finally, helping to keep people out of AFib is very important to prevent stroke. So there's a lot of reasons why people need to see a licensed acupuncturist familiar with this treatment therapy, especially if AFib is something that comes up. And in our most recent article we covered today, Acupuncture reduces heart disease risk. That's very interesting stuff. The statistics are out there. There's some great stuff in there, including the laboratory studies showing how acupuncture prevents damage to the ultrastructure of the heart. In other words, patients who have received acupuncture, when they later have things like heart attacks or problems with the heart, there is less damage to the heart. This is also very interesting stuff. I've taken a close look at myself and noticed at healthcmi.com there's a few good studies in this direction. We hope to see more. In the case of this most recent article, Acupuncture Reduces Heart Disease Risk, it specifically focuses on patients with fibromyalgia. And boy, is that a tough one to treat. We also cite some articles showing how acupuncture helps patients with fibromyalgia. They definitely are suffering from extreme fatigue and, of course, pain. But acupuncture is something that can be very helpful. But I will say that because the people are so exhausted, it may take some time. That type of treatment is not a quick treatment. Whereas getting someone out of AFib initially may be 1 or 2 or 5 visits in a short amount of time. Fibromyalgia, typically to resolve, can take several visits, but over the period of a year or more because the patient is so exhausted. All the while, they will be improving and having less pain and more energy, granted, but to really get to what we call a normal state takes a little bit longer. That's, again, what we call qi deficiency problems. In order to nourish and tonify and strengthen someone can take a little longer. So that's a little different than having excess sympathetic nervous system stimulation issues, which can be calmed and quelled quite quickly. That's something where we need to take someone who has systemic deficiency and increase the power delivered to the entire system, which certainly with that level of exhaustion and fatigue does take time. So one must be realistic on how quickly acupuncture can receive good results or deliver good results to patients. For healthcmi.com, thank you for listening. Let us know what you think. Leave a review. We hope to hear more from you. Let us know. Again, you can always hit the contact button at healthcmi.com. Let us know what you'd like to see on our website in terms of the news that we cover. If you have any up and coming news yourself, if you're an acupuncturist or in a legislature and you've introduced a bill or you work for a not-for-profit and you touch on acupuncture and herbs, again, come to healthcmi.com and click on support. Send us a link or your article that you'd like us to cover so that we can let people know what's going on. We'll have our team of authors in China and Taiwan, the United States, and we'd love to hear from everybody, though. So for healthcmi.com, thank you for listening. www.healthcmi.com.